Welcome to this week's COVID-19 Milton Keynes Council update. The number of cases in Milton Keynes remains low. Our infection rate in the past week was 0.7 per 100,000 population. It was 13.4 in Bedford and 27.6 in Luton. For comparison, the figure in Leicester was 159.1 per 100,000 when it was placed into local lockdown, and the Blackburn with Darwen area is currently the highest in the UK, with 79.2 per 100,000. The infection rate in the general population is very low, and the infection rate in care homes and Milton Keynes Hospital is very low. The risk in Milton Keynes remains moderate, given the circumstances can and will change quickly unless we continue to follow all social distancing and infection control measures. From Friday this week, the 24th of July, you will need to wear a face covering when in shops. A face covering is usually a mask or something such as a scarf. The important thing is you can breathe comfortably with your nose and mouth covered. Unfortunately, the government has not yet published the full guidance or extent of how these rules will work, but as soon as they do, we will publish that guidance on our website. There are exemptions to wearing a mask. Some of these include children under the age of 11, people with disabilities, or those with breathing issues. If you see someone without a mask or a face covering, they could have a hidden disability. It is therefore important that while we all stick to the rules, we do respect others and do not make uninformed judgments. You may be aware that the government have introduced legislation that gives Milton Keynes Council powers to make certain local lockdown decisions in the event of a significant local outbreak. These will be measures such as closing a local school or shop or business, places of worship, or areas such as parks or playgrounds. These will be executive powers, and therefore I'll be setting out the principles under which we would use these powers at the Health and Wellbeing Board next week. Milton Keynes Council does continue to prepare for a possible second outbreak, and we are taking some practical steps to do this. These include holding a supply of PPE that we'll be able to distribute to any organisation, to care homes, or to frontline staff, if needed, in the event of a second outbreak. I'm also pleased to say that after a rapid service review, we'll be reopening our library service on a limited basis soon, in a COVID-secure way. We'll be making the details of the service and how it will operate available next week. I believe that Milton Keynes Council has performed well responding to this pandemic, making sure help got to those that needed it and keeping the infection rate low. However, I am sure we do have lessons to learn, and that is why this week I was pleased to be able to give evidence and answer questions on our response to the COVID-19 scrutiny group, who will prepare a report on any lessons and improvements we have to make in future. However, it still remains the best way to prevent a second outbreak is to follow the guidelines. Stay 2 meters apart from people if at all possible, wear a face covering in shops, and wash your hands on a regular basis. If you do have any symptoms, stay home and get tested. The position we are in is because of all the efforts you have made to ensure Milton Keynes remains COVID secure. Thank you, and until next week, goodbye.